Welcome to the Illuminating Primary Care podcast, a general practice podcast brought to you by Menlo Park Recruitment. Illuminating Primary Care is here to quiz primary care leaders to offer professional knowledge, experience, and insight on the biggest topics in general practice. It's the podcast to listen to if you work in primary care. Welcome to the Illuminating Primary Care podcast.
Hi there, and welcome to the Illuminating Primary Care podcast. I am your host for this week, Matthew O'Key, and I am joined by Dr. Joe Davies, an experienced GP in the West Midlands. Morning, Joe.
Hi, Matthew.
Hi there, glad to have you. So this week we are going to be talking about burnout in general practice. It is a polarising topic, one that's getting increasing media coverage as well, and rightly so. So Joe, what is burnout, and is it on the rise?
Yeah, it most certainly is on the rise, particularly in the medical profession. Burnout is a combination of both physical and emotional exhaustion. It's actually only been recognised by WHO in the last few years, since 2019, and they call it an occupational phenomenon. And it's usually associated with long-term stress in the workplace. But I would add that I think it's not just workplace driven, and there's a blur between our workplace and our home life responsibilities. And I think sometimes it can be the pressures of work as well, and the pressures of home life that can all contribute to burnout. It's definitely on the rise. The GMC run a survey each year of trainers and trainees. So this is only a small proportion of GPs, but there's been a massive spike in the number of trainers who are deemed at moderate to high risk of burnout based on the answers to a number of questions that we get asked each year. That's gone up to 53%, which is astonishing. And I suspect a fair number of them are still carrying on, but are deemed to be at high risk of burnout. And that's a massive jump from the last time the question was asked a few years back.
No, indeed. What do you think is contributing to the increase?
Well, there's the really obvious things. I think that COVID has definitely played its part. That was an enormous pressure for everyone, and everyone sort of rose to the challenge. And I think it's having its effect now. But I think it was an issue even before COVID. I think work pressures were becoming really extreme, particularly in general practice. The workload was increasing, patients' expectations were changing, starting to look after a much more elderly population with more demanding needs, and still being expected to shoehorn that into a normal general practice model. But now with the pandemic, you had over a year, if not 18 months, of patients not being managed in terms of preventative medicine. Long-term conditions weren't being managed appropriately because the priority was to limit managing acute presentations. And so all of those patients are now needing extra care. Their health has deteriorated, and there are multiple issues to be sorted out, again, being shoehorned into the normal model of general practice with no extra time. And then there's been a gradual decline in the number of available GPs, some others that have already burnt out. It's a vicious cycle, really. And I think also what doesn't help is doctor bashing, which has happened. And certainly general practitioners are being portrayed as being lazy and not working very hard, when actually I think we would all agree we've been working harder than ever since the pandemic.
Why do you think that is? Because going off on a kind of subject tangent for a second, doctor bashing I think we could do an episode on that alone. What do you think's contributed to that in the media, and obviously then with that percolated down to the general public?
Well, I think it's the sort of mixed messages from the government as well. Matt Hancock was all in favour of making general practice much more digitally savvy. And we really rose to that challenge during COVID and kept patients safe by keeping them away from the surgery, but still managing them all remotely. And the amount of technology that was embraced within a matter of weeks to try and facilitate that. But now the general feeling amongst patients, and I can understand this, is that they want things to go back to the way they were before the pandemic. and be able to see their GP when they want to see them, and they feel that we're hiding behind our computers and we're not offering enough appointments, and that's being reinforced in the media. And the government has also said that we need to be seeing more patients, and I think we all are, and we're doing the best we possibly can. But what has become apparent is there are things that we can do remotely to allow us to be more efficient. We can sort of triage more patients if we do that remotely and only see the patients that really need to be seen. But patients aren't happy with that because they want to go back to the old model, and we're not being supported by government and to say that actually we need to be progressing and moving forward and changing how we work to address the changing needs and the changing demands of the profession.
No, I agree. Unfortunately not. Coming back to burnout, what effect does it have on a GP?
Well, I'll talk more about that in a moment. The initial effect for any GP that has burnout and has to have time off work, and I speak from personal experience, is your immediate feeling is a sense of complete guilt and failure because you've let your patients down and you've let your practice down and you've let your colleagues down. And that's an overwhelming feeling. And I think that when you first get diagnosed with burnout, when that happens, you kind of sink a bit lower before you get better because that's the first thing you feel, but you physically have no energy to give. But yeah, I'll come on more about how that actually personally affected me in a moment. Okay,
well, before we come on to that then, if we're going to talk about what effect it has on a GP, what effect does it have on a practice?
Oh, it's enormous. It sort of perpetuates a vicious cycle because if a GP goes off, someone else has to cover that work. And even if they get locums in to cover that work, that doesn't cover the whole role of a sort of salaried or partner in a practice because there's all the administrative side of things. And that immediately gets passed on to the other doctors, and that will have an effect on morale and perpetuate the problem and perhaps lead to more staff sickness. But yeah, and that's, I suppose, what feeds the sense of guilt and failure for the GP that goes off.
Yeah, no, indeed. So coming on to your own experiences then, talk me through your experience of being signed off, and when did you first notice signs that there was something potentially wrong, and how did they manifest themselves?
Yeah, well, I think the big issue, and I think this is a huge issue for anyone suffering with burnout, is that you don't really have any insight. You don't really realize you're burning out at the time. You're struggling on. I think in hindsight, I knew I was stressed, but I hadn't sort of recognized how much that was impacting on me, both professionally and in my home life. I realized I probably had signs a good 2 years before I went off work, before my GP signed me off. I was actually working as a partner in my practice and had been for the preceding 7 years. But I chose to change to become a salaried GP in the hope that that would improve things for me and improve my stress levels, because I was really struggling, particularly after I'd had my second child, to cope with the 24/7 pressure of being a partner. It's never ending. There's always something that needs to be discussed or dealt with. Even when you're working part-time, you're sort of available full-time to deal with the pressures of the practice. So I chose to change to become a salaried GP, but I had a sense of loyalty to my patients and staff, so I stayed on at the same practice in the hope that that would improve my stress levels. But actually, it made things worse because I lost any sense of control as I wasn't a partner anymore. And yeah, the more I took away, the more stressed I became. And I think that's a real sign that things aren't brilliant. For myself personally, there were a lot of other pressures. Obviously, this all happened in the middle of COVID. I had a husband who was working in intensive care as a consultant, incredibly concerned about him, hardly saw him for 6 months, so was looking after my children on my own a lot of the time and trying to work. I also was supporting my brother and his wife, who unfortunately had metastatic breast cancer, and that was taking its toll, trying to support them and my nephews. So there was a lot of things going on for myself that led to my eventual being signed off work. And what was interesting was I I didn't have insight. I knew I was stressed, as I said before, but I didn't have insight. And what was really interesting was I'm a trainer in my practice, and it was sometime in September 2020 when, 2021, when an ST2 who just joined the practice, they often sit in as part of their induction and watch us when we're consulting. So actually they get this privilege of seeing GPs working in their rooms. Normally we're all working in isolation really, and no one watches what we're doing. And this this trainee who was he'd had previous experience working in A&E, so he wasn't fresh-faced, I would say, but he had the strength to say to me, within 2 weeks of working in the practice, did I think I was burnt out? And I was really shocked. I was shocked by what he said. But actually, 2 weeks later, I was off work and burnt out. And in hindsight, I wish someone else had had the strength to say that to me, because I think the signs were all there a lot longer than that. Everyone knew that I was a bit stressed, but we were all stressed. But no one had had the courage to say that to me. And actually, I think I'm very grateful to that trainee, because that would have taken a lot of guts to say to a trainer, "Are you burnt out?"
Absolutely, yeah. I
It
can only
actually
imagine.
shows how much more awareness there probably is of the problem amongst trainees than there are amongst GPs working.
Well, hopefully that will only, provide dividends in future if it is becoming more commonplace in discussion circles and, reviews and appraisals. So yeah, fingers crossed. So on a daily basis, how was it affecting you clinically, and how was it affecting you personally as well?
So clinically, I was just exhausted. I was trying to go to work for a rest because things at home were very difficult. And then I was trying to come home from work and have a rest. So there was no rest, basically. I'd stay in bed till the absolute latest in the mornings because I just could not get myself out of bed. Going to work quite disheveled, really, not looking after myself. I was staying later at work, double checking everything I was doing. I was really quite fearful of making mistakes. I'd become really quite self-critical, close to tears all the time. And when I talk about it in hindsight, why didn't I do something sooner? But, it's hindsight is a wonderful thing, isn't it? I was really irritated with staff, particularly when I was duty doctor, which was really out of character for me. And worst of all, I was developing resentment towards my patients, really quite overwhelmed by all their problems. And the big thing was I was totally drained of empathy for my patients, which, is, for me, empathy for patients is critical. And to have none of that, and to just to try and get through each consultation rather than actually, providing care and empathy for patients. I don't think I compromised their care in any way, but I wasn't delivering care the way I wanted to and the way I've always done in the past. And at home, I had absolutely no patience for my children on the days off, because I did work part-time. So arguably someone might say, well, you work part-time, why did you get burnt out? You weren't working as hard as the rest of us. But home with the kids, I had no energy for my 3-year-old, bless him. Could just about sit in front of the telly with him, but couldn't engage with him, couldn't play with him. Didn't have any sense of enjoyment as a mother. And yeah, and I couldn't go out socially, didn't feel I had anything to contribute when I went out socially. And I remember saying to my husband, this feels like surviving rather than living. But even then, I didn't identify that as burnout. I just felt that pressures were going to ease, perhaps when the children were older, and I just needed to put my head down and get on with it.
Yeah, and I think it's so easy to be trapped in that tunnel vision when you are insular and experiencing it yourself. And I think that kind of nicely segues into the next question, really. At what point did you raise the alarm and discuss it with fellow partners and colleagues, which is obviously such a critical step in actually starting recovery?
Yeah, I didn't raise the alarm. I've thought a lot about this question, and I think I had a few conversations with my practice manager where I'd felt stressed, but didn't recognize it as burnout. And I think in one of those conversations, she'd actually said to me, "Do you think you should have a bit of time off?" And I remember saying at the time, "I don't want to take any time off. Don't want to let anyone down. I need to keep, that wouldn't be fair on my colleagues that are all stressed as well, and it wouldn't be fair on my patients." So what actually led to me having the time off was my son was off nursery with gastroenteritis, and I was forced to be at home. Well, not forced, but that forced me to be at home with him because he couldn't go to nursery. Added to the stresses of how am I going to work from home with my 3-year-old, but need to work as well, trying to work remotely. Then I got sick as well, which is really unusual. And this is a real key thing about burnout, is that your immune system gets completely depleted as well. And so, I mean, I've got a pretty robust system normally, or over all the years of being exposed to all the bugs in the general practice setting. But I came down with his stomach bug, and actually that forced me to stop. I had to take to my bed. My husband had to come home because he had to look after my son. I took to my bed, felt really, really ill, and then pretty much stayed in bed for 2 weeks. I couldn't, even though I was better from the gastroenteritis, I was in constant tears, just could not stop crying, and couldn't face going back to work. And I spoke to my GP about 3 or 4 days later, explained to him, and he said, and he put this in a really nice frame, he said, you've had an adrenaline crash. You've had to stop because you couldn't go to work, and you've had an adrenaline crash and you need some time off. And that's how it all led from there, really. And I ended up having 8 months off work. But my GP put me in touch with practitioner health, who were amazing. I was assigned to a GP who works with practitioner health remotely. She works down in Sussex. She spent over an hour talking to me as an initial assessment, and we talked through everything that had been going on. And I felt listened to, and I felt really supported. And the guilt that I was feeling about letting my colleagues down, she reassured me about that. If you get to the point where you can't physically get out of bed in the morning, how can you care for your patients? And things went from there, and I've come out the other side. So it's a positive story in the end.
I think that's the key thing to try and reinforce throughout it, because obviously there's somber tones, but I think the positivity is equally key to highlight for others in a similar situation, or others maybe at the start of that journey as well. And for those that perhaps maybe not there yet, but feeling those kind of pressures rise, is burnout preventable?
I think it is. Yes, but I think we all need to learn to recognise the signs before you get to the stage that I got to, really. And I think the government really needs to wake up to the spike in burnout risk, as identified by that GMC survey, actually. They need to really recognise, particularly having come through this pandemic, that the well-being of NHS staff is an absolute priority, and that any interventions that can be put in place prior to someone going off sick is far better than, if this doesn't change, if you think you've got 53% of trainers considered moderate to high risk of burnout, if all of them go through what I've gone through, that's a massive workforce crisis. So yes, it is preventable. And they need to make it a priority.
It's the knock-on effect, though, isn't it? Where I think it's really interesting looking at it specifically from a trainer point of view, because it's that trickle-down effect of those trainers and their interactions with their trainees. Particularly if there's more than one trainee in that practice. It's a domino effect of how many more can that hit. So, I think that survey is pretty telling. What can a GP do on a personal basis to manage their stress levels?
I think being open and honest about it, recognising it's an issue, and recognising, I think, that everybody's different and everyone copes with stress differently. We might all be under the same pressure at work, but we might all have other pressures outside of work. So the attitude, I must keep going on because all my colleagues are keeping going on, is wrong. And I think we all need to see each other as individuals, despite the fact we're all doctors. And the important thing is to make time for ourselves. I think it's absolutely key to do that in whatever way. For me, it's been yoga, running, finding a hobby. I hadn't had any hobbies for years. And I think if you spoke to a lot of doctors will say the same. Hobbies have gone out the window, particularly mums that work as doctors, because we're childcare providers as well. So we don't make any time for ourselves. And I think it allows you to gain a little bit more perspective if you're not constantly thinking about work. The thing that a lot of GPs have done, and again, this is perhaps affecting continuity in the general practice workforce, but GPs have done this is they've all started working reduced sessions as the only way to cope, because you can't cope with 12-hour days at work and do that 5 days a week. So you can just about cope with that if you do it 3 or 4 days a week. So that's what some GPs are doing. And although you might feel exhausted in that time when you're not working, if you've not got childcare responsibilities in that time when you've got at home, find a hobby, do something just for you. Each individual's different.
Yeah, that's a really good suggestion. What can a practice do? Looking at it from a practice point of view, what can they do to better support their GPs pastorally?
It's difficult, isn't it? I think making the well-being of staff the number one priority is really key. The encouraging team building, encouraging meeting up together as a team away from work, not in the rushed environment of a day-to-day, but perhaps social evenings, regular coffee meetings, and making those a priority, not if we have time, just so that you get that mutual team support. And obviously all that fell by the wayside during the pandemic. We were discouraged from spending too much time with each other, even in the practice, to prevent the risk of spreading infection. But that way of working has changed now, and I think we all are opening surgeries up more, and there's less of that restriction. So I think GPs practices should make it a priority that they're encouraging doctors, nurses, the whole medical team to meet up regularly, just for a bit of pastoral support between each other. The other thing I would say is if a doctor's behaving out of character, or any member of staff is behaving out of character, and they need to have a discussion about that. For example, I was spoken to about my becoming irritable with a member of staff. I suppose asking the question, why is this, what's this is unusual behavior for this doctor, why are they behaving like this, and then ask the question. Not be afraid to ask the question of members of staff that might be struggling. That GP trainee who asked me if I was burnt out, I don't know whether things would have been different if he hadn't said that to me a couple more weeks before I went off, because other things took hold. But I think having the strength to say to members of staff, do you think you're burnt out? Because sometimes the staff member has no insight themselves and can't see it themselves. It's a really difficult one, because obviously you don't want to be asking your staff members if they're burnt out, because you don't want them to go off sick. But equally, if you let it carry on and on and on, they'll end up going off for longer, probably.
No, indeed. So kind of look to what a GP might be able to do and what a practice can potentially do as well. But if we look at it from a central point of view, at central level, what more can be done from the NHS overall?
The whole NHS, that's a whole other podcast, I think, in terms of how to address our workload. But I think there is a glimmer of hope within the NHS appraisal process. I recently had an appraisal, which had been delayed by 6 months because I'd had time off, where in the preparation for the appraisal, for the first time ever, I was asked to rate my mood from 1 to 10. So it was essentially doing a depression score on me before my appraisal. And having just been through this whole process myself, I asked my appraiser, I said, what do you do with that information? Because luckily I'm feeling better. So my rating was was fine, and there was no indication on my scoring that I had any struggle. But my appraiser knew about what had happened to me, so I asked her the question: what do you do with that information if someone you're about to appraise says to you that their score is high, suggesting that they could well be depressed or anxious? What do you do with that information? She said, well, we don't ignore it. It's important, and we are now advised by the appraisal process that we have to signpost those GPs that are struggling. And I think that's brilliant. And I'm so encouraged by that, because the appraisal process happens every year, and it'll be a way of perhaps identifying doctors that are struggling sooner rather than later, signposting them to practitioner health early, being able to give them support perhaps whilst they're still working, rather than when they've got so bad they needed the time off. So that's encouraging, because 6 months before I went off myself, I'd had an appraisal, which on reflection, if I'd been asked that question then, I think my risk of burnout would have been picked up. And I think I might have ended up being signed off sooner, but not having needed quite so much time off. So I'm really encouraged by that. And that's really positive that they've addressed that within the appraisal process.
Brilliant. So earlier you were talking about the survey that the GMC had done for trainers. What more can be done on that? What can those surveys be used for? So what can the GMC be doing?
Well, yeah, I mean, I think that it's great that they've identified this 53% increased risk of burnout, and they've fed that information to the government, so the government is aware. But actually, why not use that annual survey to signpost GPs? So it can be anonymous, but if someone does come up when they're being asked those questions that they are at moderate or high risk, why not have a pop-up that comes up on the survey to say your answers suggest that you could be close to burnout. Here's the number for you to consider ringing practitioner health. And that would be a really easy intervention, actually. And that, again, might signpost more people more quickly.
Indeed. Now, the polarising topic to end all polarising topics, you mentioned the government are aware. Yeah. What can the government do?
So difficult. More GPs, but how do you achieve that? I mean, it's been bandied around for a long time. Previously 5,000 more, now 6,000, and I think that's been brushed under the carpet again now. But I don't know. I personally, this is my personal view, that I think the government needs to be embracing digital technology more than they are, and recognising the advances that were made, were forced on us during the pandemic, and supporting us as general practitioners to be able to deliver general practice in a more digitally savvy way, recognising that a lot of the proportion of our patients are very comfortable with digital technology now. And there is a role for both. There are definitely that cohort of patients that need to be seen and examined, but there's a big proportion of patients that can be adequately cared for remotely via video or telephone consultation. And by doing it remotely, you're providing efficiencies with practice. It can be done more quickly. And even some patients don't even need to speak to a GP. Things can be done via text messaging. And some patients, particularly those at work, really appreciate that, because they don't have to take any time out to go and see the GP or take any time out from their meeting. They can answer questions via text message and get an answer to their problem. And all of these things are here and they're all available. And I think that getting the government to back general practice in sort of embracing those changes, rather than the retrograde, you must start seeing all of your patients face to face if they want to, is wrong. There's a big thing about continuity of care, but how can you have continuity of care if you've got a big proportion of general practitioners that are completely overwhelmed and overworked, and the only way they're surviving is by not working every day of the week? How can you achieve continuity of care in the same old-fashioned way, single-handed practices used to do all those years ago? I think stop trying to shoehorn the old way of working to meet the needs that have changed enormously over the last 10, 15 years of the practice of the patients we're serving.
Absolutely. Finally, on this part of it, bit of a loaded question, but the media, what can they do, or rather not do?
Stop doctor bashing, as I said before. Support us, recognise and value our role. It's the family doctor used to be, held in respect, and now certainly within the media, we're sort of seen as the bad guys, and that we're causing the problem, particularly in terms of the constant discussion about patients not being able to see their GP, and that's why hospitals are full. When we all know that hospitals are full because there's an inadequate social care at the other end, so that people can't be discharged. So stop using us general practitioners as a scapegoat, and recognise that we're human too, and we're working as hard as we possibly can. And continuous negative comments in the media and also social media is probably leading to burnout and early retirement amongst general practice, which is perpetuating the problem. And they need to take responsibility.
Here, absolutely. So, kind of want to emphasize again the fact that this is a good news story. This is about coming out the other side. So you're at a point now where we're looking back. What are the lasting effects, though, of burnout or having timed off sick?
What it's done for me is it's made me recognize that I can't work as a GP if I'm not, and give as much as I want to my patients if I'm not looking after myself. And I think in order to give that much to my patients, I need to be protecting my work-life balance much better, and actually allowing me to be able to work in a way that means I can give to my patients and to my family, and there's still to be something left for me to enjoy my own time as well. It's not easy, and I think having been through what I've been through now, I am careful not to overcommit to things, and I make sure I give myself time each week that's just for me, and I don't commit to things on a certain day of the week, so that I've got that time just for me. Because I love being a GP and I love helping people. That's why I went into the profession. But yeah, it's all about setting boundaries to make sure that I'm not overstretching myself.
Has it changed your outlook on being a GP?
Yes and no. I think it has, because I think I think in the past I probably wanted to try and react against the system, and now I'm trying to accept that I can't give more of myself than I have, and I think the big thing, and I've spoken to my husband about this a lot, is that I'm trying to stop. And I think this is probably true of a lot of doctors and particularly general practitioners, is that we feel identified by our role as a GP. And I think recognizing that there is more to us as individuals than being GPs, and that we have other qualities and another part to our life, gives more balance, and stops you perhaps giving so much of yourself to your work to the detriment of home life.
Absolutely. So we touched on kind of what could or maybe should have been done differently at the start of that journey. What advice would you give to a GP returning from time off with stress or burnout?
I think the key is to take it really slowly and to listen to the advice of your GP or practitioner health who might be supporting you, or your counsellor, and don't rush back. Allow them to be objective for you, because I think it's really hard to not have this constant feeling that you need to get back to work soon, so that you're not leaving your colleagues firefighting in your absence, and accepting that you've burnt out and you need that time to recover properly. And if you rush back, you could end up in a bigger hole later down the line. And so take the advice of the people looking after you. And I think it's really difficult as doctors to take advice from other people, from other healthcare professionals. But once you accept that, I think that helps enormously. And when you do go back, don't rush back. And most importantly, question whether you should go back to the same job, whether that's the right job for you, and what changes need to be made to make it the right job for you, and have that conversation with your employers. Whilst I was under practitioner health, they recommended I got some life coaching through an organisation called Project 5, which is well worth people being aware of. You get 3 sessions through Project 5 with a life coach who is a professional life coach, and they normally charge quite a lot of money, but any member of the NHS can access this. And I found it incredibly useful because it gave me the opportunity to work out what my strengths and weaknesses were, the things that got me stressed, the things that gave me the most enjoyment through work. And it helped me to work out how I could go back to work and avoid becoming overly stressed and burnt out again in the future. So highly recommend accessing that.
Brilliant. So other side of the fence, what advice would you give to a practice to support a returning GP?
Give them time. Obviously talk through a phased return, and ensure that there's regular catch-up time as well, and ensure that I certainly, when I went back to work, I was significantly slower than I'd been before, and I'd lost a lot of my confidence having had time off. And I think recognizing that a GP coming back to work after burnout is going to need more time. Not going to get through consultations in 10 minutes and might need longer, might need a bit of catch-up time between each patient as well, and might need to talk through patients a bit more with their colleagues until their confidence levels come up. And it doesn't take long, but that's a real fear. And I think that fear could lead to someone not going back as soon as they could if they feel they're just going to be thrown back in the deep end again.
Yeah, indeed. Listen, it's been really, really thought-provoking speaking with you today, Joe. I mean, closing remarks. How do you feel now after the whole experience, the whole journey? And what would you say to others in a similar position?
I'm really glad that you invited me to do this today, and I'm really glad that I've come out the other side and I can share my experiences, because I feel passionate about raising awareness of this, and I hope that this podcast might, prompt some other people to think about seeking some help early. I know that having come out the other side, I'm a better doctor, both in terms of the experience of having mental health issues myself. I'm much more able now to support my patients with mental health issues. But more importantly, I've got a renewed energy levels, renewed sense of enthusiasm for the job, and a sense of reward. And I've missed that for years. But that's back because I've taken steps to ensure the work that I do now is not impacting on my work-life balance and allows me to have some downtime as well. And I think my patients are better cared for because I'm caring for myself.
Yeah, well said. Dr. Joe Davies, thank you very much for joining me.
Thank you. Thanks for inviting me. Bye-bye.